What was that?
I don't know.
Okay, so I'm going to go ahead and start with the East Clinic. Team lead is Jay Olivares. Yay! For HB, we have Minnie Olivas, team lead. And co-team lead is Maria Galvan. Maria. I know this is your first meeting, so welcome to all of you. And we also have a farewell. Unfortunately, Anthony will be leaving us on Friday. Will be his last day, August 16th. Are you going to home health?
I'm going to try doing that and then go back to school.
Good for you. Yes.
Good luck, babe.
Yes.
Thank you.
And then just one thing in case we don't get to my section, I just wanted to show you all the t-shirt that I sent out an email to the OCs. This is the one that the company's decided to select, and it's going to go, all the money, the proceeds are going to the El Paso Community Foundation. So they will disperse all the monies allocated for the victims of our tragedy at Walmart. Okay, and Rudy, you have something before we get started?
So real quick before, and I don't want to bore you guys, but really quickly, let me say a few words. Welcome, all of you, to our meeting, and just want to say that it is, I am grateful, we are grateful, El Paso Therapy Services is grateful that you are here, that you are safe. In light of what happened 2 weeks ago on August the 3rd at our local Walmart, I know that some of you might have known some of the victims' families or friends or employees of Walmart, and so in light of that, I would like to ask for all of you and myself, all of us, to just have a moment of silence for the victims and their families. So let's please put your heads down. Thank you, and we are very grateful that you are here safely with us. Okay, let's continue.
Okay, first up we'll have Chole with compliance. Clinic services and training. She's got quite a bit of time. Oh, okay. Sorry, I have to use it.
We thought of just catching you up on some of the compliance and regulations that we had discussed in our last meeting, so that all of us, regardless of where we go to practice each day, will be practicing equal, more so for the billing department. We can make it easy for them. Oh, it's just so much. We just found out today at our morning meeting, they produce 11,000 claims per month. Kudos to them.
Wow.
So that's a lot of claims for three people who do it. But I think what I want to say is that the cleaner that we can create it at our level, the easier it is for them, because insurances do everything in their power to hold back the money. So if we give them no excuse to hold it back, it makes it easier for them. All right, let's start with functional limitations. The FL reporting upgrade, if you notice, you do not want to be using the word G-code anymore. It doesn't exist in the world of Medicare, and it does exist in the Texas workers' comp because they still hung on to it, but we are still required to do what we call functional reporting. So the FL reporting is going to continue through the end of 2019 for all traditional Medicare and MAPs, and it will also continue to occur for Texas workers' comp. So correct me if I'm wrong, but the Texas workers' comp is the only one that will actually produce a G-code in the billing section. Am I correct? Just to let you know. But we're still going to do it primarily because this group doesn't seem to have its act together when it comes to billing. They still want to challenge us. So as long as it's in our documentation, we are getting paid for it. And then I do ask that documentation continue to be reported in our software under the additional findings section. All right, let's go on to CPT code 97530 utilization. Big thank you and congratulations to the entire professional team. All clinics at this time have reached the 40% plus of what we call total units submitted. So 40% of the total units that we submit are now under 97530. This is a code that belongs to our profession. It is the rehab code, the functional code. So thank you very much. I do also want to say that when we've done random audits, there's excellent documentation to support your utilization. PTAs, we can't thank you enough because there are times when we do the evaluation, we'll keep them from 1 and 2, you all take over. And for you to come up with the exercises to progress into the next level and you land them right here, wow. That really sets you apart from what I call a lot of PTAs who just really don't grasp that concept. So really congratulations to all of you. Keep up the good work, because I know that's what Sylvia wants to say. All right, Medicare. The 10-day reporting continues to populate for traditional Medicare only. So when y'all are in your daily screen PTs, you just go up and you'll see Medicare up there. And then to the next, you'll see, oh, Lydia, correct me, to the next, because it's not a map, it'll say traditional, what does it say? Medicare and then, anyway, if it's a map, it'll say UHC, it'll say one of them, but if it's traditional, it stays at Medicare. Part A? Does it say Part A? That way you know, automatically these are going to have a little yellow section when you are ready to click and create your document. Whoops, sorry. It'll have it in yellow. It's a long yellow line with a box in front. It says this visit is a progress report. And so and then on the left side, it'll tell you, it'll show you the big red sign, stop sign that says stop. It's already been 10 days. You can remember, you can check off this box before 10 days if you happen to do the definition of reporting. Progress report is when you've taken range of motion measurements, any type of test and measures, and then you've gone into your assessment and you've made a clarification assessment. That's automatically, we know, a re-eval, but it's also can be done anytime. So you don't have to wait until it populates if you choose not to. But this is important. This, you will lose money with a random audit if this isn't checked off. So it's not the checkoff, the software is helping us, it's in the documentation. So if in a random audit they ask and they look at the 10th visit, 10th day, and you did not do tested measures and redefine your plan and redefine your assessment, then we lose that case. And by that time, the average reimbursement is $92 right now, across the board, approximately. And multiply 92 times 10, and they recoup all of that money. And the way they recoup it is on the next month, they subtract that amount. So be very, very perceptive about this. Don't let it skip. PTAs, if you land on a stop sign that day, don't close it. Please make sure that the PT gets back. And you should know because it's clocking you. It tells you 7, 8, 9. It starts to warn you. But don't close it. The PT has to close it if indeed. This is why I tell you if you're going to take measurements for, like, say, a doctor's report, which is not the same as a progress report for Medicare. It's the same, we use progress reports for doctors, but if you're gonna do it and you're doing all that section, it's a nice time to do it. Find what works for you, okay? We're not here to tell you how to do it, but that it needs to be done. All right, reevaluations for Blue Cross Blue Shield and Ambetter, that combination. Big reminder, the reevaluation and the treatment cannot be performed on the same day. You can complete a reevaluation or a treatment visit, but not both. So I first of all get your minds right here. Highly recommend that when you do your your initial evaluation under Blue Cross Blue Shield or Ambetter, let your plan of care finish in 60 days, even though the doctor only gave you 8 visits or only 12. That's what it's going to be because that's what you and the doctor decide or agree to. But when it comes to the box below, hit the 60-day. Because that way, if you finish, you don't have to be doing a reevaluation. You can just go on until they come again. And this is where we get hurt. So you finish your 8 or your 12, come back with a new prescription, you have to do a reevaluation because you have to establish a new plan of care. So at that point, you can either, and if you choose to do a treatment which would benefit the patient, usually the treatment total is gonna cost, they're gonna pay you more than just a reevaluation. So recoup the reevaluation code if you choose to under the 97530, and then document the assessment and clinical findings. It's really important. Yes.
So the reevaluation won't count as a treatment day? That's the only thing I get concerned about when I have a reevaluation and treatment for those Blue Cross Blue Shield and Ambetter, that they'll lose the treatment day.
Okay, so if you don't want them to lose, you still have to, by license, do a reevaluation, but I put a 0. Okay, and then if I recoup, you can recoup your time under 97530. However, you have also the right to just do a reeval. That's a choice you can make. So today, sir, we're just gonna do a reevaluation, insurance requires it, and then, there you go, you're submitting the reevaluation code. Okay, but not both. So, more money the other way, just FYI. Okay, Optimus, on the absent discharge. As all of you know, Optimus recently upgraded the software. And in doing so, when you are a provider and you close it, you can't change it anymore to another provider. And so what we were finding is that some of us, including myself, we use PTAs to assist us in gathering data for absent discharges. And when they closed it, I couldn't go back and change it to Soledad. It was stuck at Joe's name, and I think a few others have had that problem. So for right now, EPPTS is in the process of determining how the PTA will assist in the APT in gathering the data for an absent discharge. There are some of you here, PTs, where you do your own absent discharges and continue that same momentum. But right now, the PTA cannot. Now, you can, these are all absent discharges. These are all absent discharges. So we're gonna hold on that. The 2 clinics that really we're watching all 3. And so until then, just do your own absent discharges, have someone enter some data, but right now it has to stay under your name. Any questions on that? I know Rudy, all the clinic directors are aware of this, and so we're working through. We have sent numerous support questions, but it comes back down as, what does your state allow? And our state allows PTAs to gather data for a discharge note. It just does not allow a PTA to sign the last documentation. So PTAs, wherever you guys go, don't ever sign a discharge note by yourself. It's illegal. Yes.
So as long as the PT would maybe start the absent discharge, it'll pull up in their name, and then if the PTA wants to go later to enter all the data in there, then it won't show up under theirs, right? They'll
Correct.
Way around
Correct,
it versus if when Joe would do it, he would open it.
He would open it
his,
for me.
Start absent discharge, and then it says Joe on there. Yeah.
So whichever way we're gonna propel forward, I think as long as you protect your license, number 1, because we're accountable to making sure that you understand your license and the state law, and number 2, that it's working for your team. Okay, I'll be watching it along the way. Okay, in-services. I think a few of us are, not a few, the entire company has that in-service law. We thank Amanda for doing 98% of that work. So there are 2 disasters that we have to go over. It's important, the importance of reviewing the disaster in-services, make sure that all staff members are present and reflected in the sign-in sheet. Monica's going to be looking at that sharply, especially in light of what happened to our city. I really want all of our team to know, what do we do in a disaster? So that particular in-service, I know that there's some in-services are just for the techs, but that one, all members. If your staff is absent on that day, they have to make it up. They just have to go in and say, I reread it, and this is what I read, and this is what I understand. But make them articulate it, because I think it's real important. And then they have to sign in that sheet and the date that they spoke with you. But this is And we have a beautiful disaster in service in place. All right. Okay, TRICARE, let's talk a little bit about that. Until TRICARE determines when the regulation goes into effect, a PTA cannot treat a TRICARE patient. So y'all are gonna have to be real, real careful. So starting with this section right here, really, we extracted it verbatim out of the regulation documentation from TPTA. So the Department of Defense to have changed no later than 2021 with the possibility in early fall of 2019 or early 2020. The decision's already been made that PTAs will be able to treat TRICARE patients. It's just that it's not in the regulations. So therefore, if they audited, they will not pay you. So we've decided to take a stand that just period, our TRICARE patients cannot be treated by a PTA until later on. So each clinic to identify the TRICARE patients and assure that they are scheduled under a PT. And work on that at your own clinics. That's what whiteboards are for, our weekly whiteboards. Just see what works for you. There's not a magical method that I can announce up here, but that this is where we need to go for right now until possibly these dates come around. That's the Department of Defense. I didn't realize that it still has to go through them. All right, facility registrations with the state of Texas, just an update. So in the HB 29, which was signed by Governor Abbott, they did amend the provisions which included that a PT facility will not have to register effective September 1st, 2019. I don't want any of your PTs to get scared. This is the story right now. Our license expires August 31st. And what they are saying is that when you expire at 12 p.m. that day, at 12:01, you don't have to worry about it anymore. So we cannot go after you. They will not put that in writing for us. We asked, but they said you just have to. So I took it one step further. I asked my nephew, who's a policeman, I said, if you stop a car at 11:59, and they said that their license expires that day, he says, I can't give them a ticket. But if they're drunk, and I'm suspecting it, I hang out a little bit until it's 12:05. And then he says, I take them in. But he says, you're right, I cannot cite someone for having an expired driver's license if it is still that last day. All right, so just thought I'd share that with you. So don't worry, at this point, just all close your eyes at 12 midnight on the 31st and let 12:01 roll around and we'll be fine. So we're not gonna have that out there anymore. All right, let's talk about the other thing that was included. Many things were included in the HB 29, but the impact for a big historical moment for the state of Texas. We are now the 49th state that has direct access. It's very specific though, so one of the things that I do want to say is down here. So effective September 1st, you can see a patient without a referral for no more than 10 consecutive days for the physical therapist who possesses a doctoral degree in physical therapy or has completed a minimum of 30 continuing competency activities in differential diagnosing. Okay, so that is Rudy, Chola, and Amanda.
But isn't there also that they have to be practicing for a year at EPT?
Minimum of 1 year, yes. And I'm going to tell you, you all have to go read your own. We hold you responsible for reading the act. Now, TPTA has been very good about publicizing information. So one of the positions that we're taking for the three of us is that we made this vote, so Amanda, we're in it all, three of us together. We're going to complete our 30 hours of differential diagnosing so that when Margot is out there marking for us, she doesn't have to say, oh, well, at this clinic you can go, but at this one you can't. We want it to make it very smooth. And we do. Rudy, did we give ourselves a deadline? I think December 31st.
December 31st.
Okay, so
Completed before that.
So allow us to go on our continuum meds or do what we have to get differential diagnosing. Some of us already have hours in that area, but 30 is the magical mark, and I know I don't have 30, so. All right, any questions on that? Yes? Oh, no questions? Okay. All right, let's go next. Oshcon. The recent Oshcon inspection was excellent in all the 3 clinics. I don't mean to not acknowledge, but I do want to say that Armando, the team leaders and the office staff especially, you all make this happen. Because while we're in patient care, you all are hustling to make sure that the clinics look to perfection. He did not find one thing, and I know Rudy mentioned that last time, but I do want to say congratulations. We really, to us, this is a reflection that you understand the importance of enforcing regulations in our day-to-day practice for the safety of our patients and us as employees, so thank you. Anytime you see something, bring it up. All right, CARF. It's been a long time since we were CARF accredited. We don't log, but I ran into something. So I ran into a standardized exercise that we all love to use on a regular basis at this clinic, and I saw the CARF logo, and it is illegal to use the CARF logo in anything. So team leaders, I'm going to ask you for a favor, and office staff, please review anything that you all just have standardized copies on. You know, there's some of us use, I think, the lumbar stabilization, we have it all down, Bell's palsy, exercises, just everything that we use is standard, that we don't go download. And make sure that the CARF logo is not on there, it's not being utilized. If it is, we've got to reestablish. And I'm just, at this point, I'm going to hold the team leads and the office staff in collaboration with the office coordinator responsible for that. So no CARF logos allowed. All right, TRICARE provider updates. Rudy provided this information from a gentleman named Adrian Estrada from EMSI. That's their logo right here. So he gave us the regulations. So he said PTs and OTs can order durable equipment in 2015. So we went through the whole process, and we did not know that since 2017 this has been possible. So what he's saying that EMSI is requesting, if you find that you have something to do with a TRICARE patient that requires durable medical equipment, have the patient sign and initial the patient information, and he provides that form, and then he will take care of getting the approvals all the way through. So if that comes up, PTs and PTAs that you identify durable medical equipment, PTAs, you have to go through the PT, because your state practice act does not allow you to order durable medical equipment. Just tell them, I think this patient would benefit from what XYZ. Tell your PTs if you're overseeing that care, and then if she or he agrees, then they can begin this process. But this is only applicable to TRICARE. Clinical services. Just a reminder that we are no longer accepting urinary incontinence patients, with the exception of Amanda and at the west side. So if you want to, you can refer them to Tier 1, which is Kathy Roth, or to Spectrum. But Amanda, I think you are still taking some? Do you want to continue taking? Oh, good.
They're so time consuming, and we
They
hardly
are.
get like 2 a year. It's just.
Oh, good. So, Margot, so we're in it all together now. Yeah, so I just always know who to refer them to. Do you feel, PTs, do y'all feel comfortable with Kathy? I do. And then Spectrum, I know is, and I'm sure UMC has some, and Margot's no longer marketing that population, so. But we're still, once in a while, we get phone calls, and just real courteously, tell them where to go, okay? In terms of referral. All right, the student program right now at the high school level. I just want you all to know that if you're working at the West Clinic, that we will be partnering up with EPISD for a teaching internship with the Center for Career and Technology Education program, and they've already, so if you see a student trickle in, you'll know what's going on there. And I know that the East does, how is it that we get involved with Bel Air? How did we get involved, Chelsea? With Sarah, how did she end up coming? She called us? Okay, all right. We partnered, Chelsea partnered with,
Medical program, I think, wasn't it? Like,
Yeah, they have a health magnet at Bel Air.
Health Magnet program, so we kicked in through that. blood flow restriction, just one thing that we are asking, operationally maintain an active list of the BFR patients to assure proper schedule color coding. They need to be in red. That's how Sylvia's maintaining stats for us. And then the office staff will review at weekly huddle with PTs to maintain updated active lists. Whoever oversees that, just take advantage of the weekly huddle. And I think it was last Tuesday, we formally approved that we're getting a third BFR piece of equipment, so every clinic is gonna have its own. We're just, are they giving us an estimated time of arrival by any chance? For the new BFR?
By the 22nd.
22nd of this month, okay. So then we're not gonna have to be taking it, Rosie, you'll get to rest. I know, thank you, we did, doing well. This has been a tremendous direction in terms of services. All right, training and CCUs. At this point, the most common diagnosis is taking a little change in its direction. Lumbar spine conditions are our number one diagnosis that we treat. Knee is second and shoulders third. And those are when we looked at the stats across the organization. So clinic directors, we really encourage that when you approve continuing education, approve them along these areas of strength. We need to strengthen our clinical skills and maintain them strong. We need to be offering what we call gold standard, because insurances are not giving us very many days to rehab these patients. They are cutting you, and you want your outcomes to look good. Because you are a PT and you want the name of your reputation to look good. So a lot of good, for those of you who are very young, you're already in this program, but for us who've been practicing, we used to have so many more visits to rehab a patient. And so, we had a good reputation on that, but now we have to make that paradigm shift. And so really emphasize your continued aids in this direction. Okay.
Next up is reading regarding operations.
So,
Does that count towards
CCUs. Technological CCUs.
I get .1. All right, so
0.001.
in operations, it's going to be really quick. I only have a couple of announcements to make. Operations is ever changing, of course, and every clinic hopefully is following all the operational standards that we have. And it's obvious because the company is doing very well. And I want to applaud everybody here because it's a team effort in operations. Please clap for yourself. So, just a real quick, first, okay. So, we are going to be closed as usual for Labor Day. So, the signs should be up in each clinic that usually goes up for the patients to know that we'll be closed that day. If you have open gym, make sure your open gymmers know that we're closed that day so that it'll show up because that has happened before. Okay? And it will be closed Monday, September 2nd, and then resume regular business hours on Tuesday, September 3rd, and that's the usual verbiage on our signage up in the clinics. Okay. Second thing, you'll notice probably already by now, and I'm sure the front office for sure, is that Optimus has upgraded us to where now they give us a notification of a patient's birthday. And that is fantastic because it falls in line with what the company wants. And that is to, when there's a patient's birthday, that we acknowledge them that day, or the day before, or the day after, whenever, but now we have it for that same day. It is in 3 different parts of Optimus. It's on the home page, and it's right there with a little gift box, and it's on the home page. It's also on the visit page. If you go to the visits, it is located, and again with a gift box, and birthday is today. For that, we should have Happy birthday, Victoria. So, and then the third place you will find this, and it's very helpful, is in the check-in page, and that is located on the right-hand side. So we really shouldn't miss a patient's birthday because it's on 3 different areas.
Okay.
And they really appreciate it. I know Chole shared a story with me this morning in our meetings, and I had one just the other day where the patient was in the room. It was a new evaluation. It was her birthday that day. I finished all my talk and my selling points, and then I told him, by the way, happy birthday. And she's like, oh my God, my family doesn't even tell me that. And so, you know, they really appreciate that. Okay? So those are the operational issues. Any questions on this, on the notices? No? Everybody seen it? And if you haven't seen it, open it up and look at it because it's important. Okay? So next up.
So, yeah.
Before Sylvia gets started, I just wanted to mention, I forgot to earlier, that the information is on public, under the public folder for any of this information that's being presented today in case you all need to refer back. Thank you.
So,
Hi.
as Charlie mentioned, today in the consulting meeting that we had, it opened my eyes that we process that many claims. So we have a lot of responsibility in all of us, you know, it's a team effort, and thank you all for always helping us and understanding our responsibilities. So with that in mind, we continue to ask for your assistance. So I'm gonna review with you all the, and documentation and to include charges, deadlines. So as the type of visit for follow-ups, which are the daily visits or modalities, and the progress report visit on the type of visit in Optimus is due next business day. So, and here, regardless of the appointment time, we say next business day by 1 p.m. We have Teresa, our biller at the business office. She starts billing every day at 1 p.m. So please, it's not next business day 5 p.m. You saw the patient at 4:30, and it's next business day by 1 p.m. So please keep that in mind because as the stragglers, the straggler report that we start, you know, documenting there. Then for initial, which is the evaluation and re-evaluations, is due within 48 hours, and those are business days. So, of course, if you see the patient on Friday, so it's, oh, I put it over there, sorry. So, now here in the comment, I'm saying preferably by 1 p.m. because we do billing on a daily basis by 1 p.m. So if the patient is seen on Monday at 8:30, so it will be due on Wednesday at 8:30. But if you see the patient on Monday at 4:30 p.m., we ask if you can finish your evaluations and re-evaluation, the documentation as well as the charges by 1 p.m. So you all can help us, our biller, to when she starts with at 1 p.m. She works on the evaluations and re-evaluations from the day before because she's just waiting for those to send the billing out. So any question on the deadlines? No? Okay. So now, along with deadlines, of course, we have leave of absences for the professionals and all full-timers. So we had PTO, CCU, sick time, duty, FMLA, personal day, bereavement, holidays, CPPTS, functions like today, meetings or any gatherings or closures because of weather, and any other type of leave because there are emergencies, unforeseen circumstances, and the company, EPPTS, the board members are very family oriented and they understand, you know, circumstances happen. So that is approved and we just need to manage, you know, that time off. So if it is scheduled, your time off greater, more than 1 day, so that's something that can be planned. So all the documentations and charges are due before leaving for the scheduled time off. Because you already know. You submitted it, you put it in advance, you submitted the request, you know that you are gonna be leaving. So it's not like it's due within 48 hours of the next business day. You just need to make sure that you finish, you complete your documentation and your charges before you leave. And as I mentioned, some leave of absences that I just mentioned on the top can be planned out. So, if you have a doctor's appointment, if you have duty, if you have holidays, company holidays, we know, those are coming up. So, again, discuss with your CA and your OC to coordinate your schedule for time off. So, or closures or things, that the company, that we know in advance. So it is your responsibility to make sure that your documentation and your charges are submitted. However, for the ones that are absences that cannot be planned, what we ask is that you report to your CA and OC as the documentation still need to be submitted on a timely manner. And those are going to be coordinated based on the circumstances. So if you are sick, you're not feeling well, you got home, you were sent home sick, and so of course we want for you to rest, get your vitamin C, your medication. However, we don't know if you're going to be ready to come to work the next day. But you also need to be responsible for your documentation and your charges. So please work with your CA and your OC so that way you are meeting your deadlines and you are not putting behind the billing, because without billing, revenue is not here. The money is get delayed, and then I cannot sleep at night. Not just kidding. but payroll week, remember, if you're getting paid on that Friday, just remember documentation, you're holding the revenue, and your paycheck is in dangerous. Well, just think about the Fridays, every other Friday that we get paid. Now, on duty, lately we had come across with different circumstances where our professionals had been selected, as yours. So usually it is canceled, so by the time that it comes, then they send you by email or text that it has been canceled, so you can check before in advance. However, then we have those circumstances where they are selected as yours, and then it takes time for them to come back to be able. The company supports and you get paid for being a juror, it's a community service. So we ask that you also you are responsible for the community, and EPPTS is paying you for your time to attend, for duty. So please continue your responsibility, carrying on that responsibility with the company. Because a lot of employers, they don't need to pay for duty, and that's why they pay you $6, so probably $10. I think I got paid like $12 the time that I was selected as a juror per day. So you don't know if you're gonna be selected. So make sure review your patient volume, your patient list, your stragglers, and make sure that if you after you finish your duty for that day and you are selected to go the next day, well, you also need to coordinate that and have made some time so you can catch up with your documentation and charges. So if you can help us in that area. When there are changes in the clinic schedule due to holidays, CPPTS functions or anything, so something that like today we had a meeting, or like we are gonna have a gathering, or always think ahead and plan ahead. Yes, we all get excited, things happen, sometimes it's to our advantage, we'll be close, or sometimes it's not a good timing, a change, or we don't adapt to changes very well. Well, think about your responsibility, because documentation deadlines is still applied. The consultants say this is your goal, did you meet your goal? Did you bring in the visits? Did you bring in the revenue? They don't care what happened. They don't care if you got sick, if your children, your family, nothing. They don't care about that. They just care about numbers. And this is a business, and we need to think as business, also business people. So we have that responsibility. Documentation deadlines still apply. For MD appointments, full-timers, and this is all full-timers, exempt, not exempt professionals, we are expected to return to work unless the appointment is scheduled late afternoon. So if your appointment is in the morning, yes, you have the benefit, it's a benefit, a sick, to get paid for sick time. However, yes, sometimes, the visit to the physician's office takes time, but you're not gonna be there 8 hours, or you're not gonna be there 6 hours. So if you schedule in the morning, you're expected to come back. So that's why we ask for a MD note, so you can always, you need to come back to work. So please make sure, think about, we have a lot of benefits. The company, pays for a lot of benefits. So please, be considerate about those benefits that we have. Because we have a lot of employers in El Paso that they don't pay for that many benefits. So we have deadlines to meet. In the billing office, I have deadlines to meet. We all have deadlines. I need to bring in the revenue. So please help me. Let's continue to work as a team and get the goals, meet the goals that we need, the expectations. Questions on the documentation and leave of absences? This is a different subject. We just want to let you all know that we are our efforts continue in looking for a PT and a PTA for the company. So that hasn't stopped. We are glad that Stephanie has joined our company. So, but we are still posting, the openings that we have, and looking for people, interviewing people, and until we are fully staffed. So right now we are not. So you are doing a very good job. We are strategizing, and I know today we talk about that. So we continue with those efforts. If you know anybody, send them over. Ask them to submit their resumes. Any questions? That's it for me.
Okay, so I am going to go over telephone procedures as far as what to do in the event that we lose the internet and our telephones go down, and also so we can forward our telephones in the event that we have a meeting like today, we know where to forward the telephones appropriately. I also asked Monica to give everybody a handout because I'm going to go fast because also we're kind of have to go back to patient care. So if you have any questions, you can always refer to your handout. Okay, I want to start off by introducing the website. It is officeuma.com.login, and this is going to be your front page. I am going to individually email the office coordinators and Sylvia your login information so you can have access to your specific facilities. Okay, for the East Clinic, the way that it is set up is call forwarding mode is already enabled whenever the devices notice that it's gone offline. So there's nothing that you guys need to do when we lose internet. The system is automatically going to kick in, and it's going to kick in, it's going to forward them to the Horizon Valley facility. If you would like another facility to forward them to, let me know and I can make this change for you guys. Okay? Horizon Valley facility, or whichever facility that we're going to be referring to. On the caller ID, you're going to see El Paso Physical Therapy Services, or EPPTS, or EAST, or HV, kind of giving you a hint that it is a call from another clinic. Okay? So, if I'm at Horizon Valley, and I'm seeing the phone's ringing, and I see something that says EAST, followed by the name of the person that's calling, I automatically know that it's for an EAST clinic patient. Okay? I know it's a lot, but you'll get used to it. But I have a feeling that this is going to help not miss any phone calls with one of our facilities go down. Because in my experience, it's very rare that all three clinics are down at the same time. It's usually Horizon's down because of all the construction, East is down because this is a busy center, and West is always down because West is West. Okay? So, yeah, no, and honestly, and I want to preface everything by saying that 2017 was really quiet for internet outages. 2018, this year has been really rough, and that's because Spectrum is changing, is converting all of their technology to fiber optics. It's been a real rough year for outages. Hence, we had to come up with some kind of system. Luckily, our telephone systems, the moment it detects that there's a signal missing, it's going to kick into this automatically. Okay?
Thank you.
So the West Clinic, again, it's, call forwarding is enabled when the device is offline. It notices it's off, it's going to immediately kick over. And I kind of chose the Horizon Valley Clinic just because of volume. It might be easier for Horizon Valley to be able to answer those type of calls. And again, it's going to show the original call number, meaning it's going to say West and then the phone number. For the HV Clinic, again, same thing. And then I forward those phones here to the East Clinic. Again, if we want to change that, we could completely change that. It's dependent on what you tell me you want. But once this is done, this is going to be the default setting. So you got to kind of communicate with me and let me know. Okay, for forwarding phones, we're going to have a luncheon. The clinic is going to celebrate a birthday. We want to transfer for an hour. We're going to step out. This is going to be the procedure. Okay, when you log in, you're going to enable call forwarding mode. You're going to choose the phone number that you want. So, hey East, Horizon Valley is going to go celebrate a birthday. We're transferring the phones for about an hour and a half. Is that okay? Sure, we have somebody here. Okay. And then, make sure you save your changes. Okay, you have to click save. So now, when you go out for lunch, the phones are going to be forwarded to the phone number that you designated, the clinic you designated. Okay, so when you return, you have to go back to its original settings. So you need to make sure that from enabled, you change that back to enable when devices are offline. You have to make sure it goes back to that original setting, and then you click save. Okay? Then you need to make sure that you put the proper phone number that's going to go to the clinic when your phone's offline. Again, it's a lot. That's why I printed it out so you guys can go back and review it as we go along. And key, you must hit save at all times in order to save that. Okay? So this is your forwarding procedure. When your internet goes down, you automatically are going to get your phone calls sent to the clinic that you designate. I temporarily designated these, but if you want to change them, please let me know. We can change them, and we can go from there. Then these are the procedures so you can forward your phone. So when you step out of the office, or you're going to have a critical meeting and a clinic director wants you to forward the phones, you know how to do that, or you're going to step out of the clinic, you can do that. Okay. EPPTS hotspots is the other subject. The hotspots are intended to provide temporary internet during an outage, and that's all it's designed to do, is to keep the PTAs and a select staff up and running. Okay, it's not meant to stream music. It's not meant to print. You can't print. You can only keep working on your notes and seeing the patients, checking them in. It's not meant to scan. The printer's not going to work. The scanner's not going to work. It is temporary internet. Okay, so up to 10 users can use the hotspot at the same time. However, the more users, the slower that hotspot gets. So we want to limit the users to all PT and PTAs that are working and one front office personnel. It's a guideline. It's not set in stone, but this is what I recommend because it will slow down your PTs in the back if you have too many on there. It'll handle everybody, but that's not what it's designed to do. It's very, very temporary. Okay? And effective last week, I've turned on all the hotspots and they're to be active at all times. Because what I was finding is I was getting a lot of calls saying the internet's down. Well, Where's your hotspot? Oh, I gotta turn it on. These hotspots are unlimited in the data that we can use, so there really is no reason to turn them off. They are completely turned on, so whenever there is a outage, PTs, front office personnel, look for your hotspot. It's called HV hotspot, East hotspot, or West hotspot. Okay? They're just always off, so they're never to be turned off anymore. Okay? And that's what I have for IT. It's phones and hotspots.
Okay. I have some good news to share. Rudy mentioned that Misty Valenzuela, she was a PTA at Horizon Valley. She's rejoining our company, and she'll be with the West Clinic on Tuesdays and Thursdays all day. And date of her start that'll be announced later. But that's exciting news for us. Yeah. So for those of you who know her. So now I'm going to go back to my T-shirt here. Just so you all know, because I didn't finish explaining them. So the El Paso Community Foundation will be getting the proceeds. The cost is minimum $12, so the company will be pitching in $6. So it's only $6 out of pocket for our staff. And that can either be given back to the company via check, cash, or it can be payroll deducted. So the names and sizes are to be turned in to me by Thursday, and I'll be ordering them on Friday. And then once they come in, we'll distribute them to each of your clinics. Okay, for marketing, can we lower it?
Yeah,
Thank you. Just for your information, the referral status, year to date, company-wide, we are up 5.3% on referrals. So that's music to my ears. That's So I appreciate all the front office staff. I know you guys do a lot of work, Lydia, case management, all the work you all put in to bring these referrals in and not miss out on any, which is important. So we've noticed, I did a little data gathering for June and July, because we're getting such, I know this has kind of been since the beginning of the year, but specifically for June and July, the total of referrals was 42 on 22 William Beaumont and 2 VAs. Texas Tech, 9 referrals, out of town 7, and 2 local. 43% of our referrals is from the military. So that's a huge influx. And I know you've probably noticed too, Lydia, VA's down, but Beaumont is just really soaring in our referrals, which is interesting, and I hope that doesn't go away. I hope it continues. The competitor boards, let me get those, excuse me. I wanted to show you all, I don't know if you can see. Not too much change in Horizon Valley, but more so on east and west. Can we turn the lights on up here in front, please? Thank you. Excuse me. So I wanted to show you all, this is, which one's this? This is east. I want to show you east first. On east board, I don't know if y'all can see it. The dark yellow with red flags. Thanks, Rudy. So thank you. So the dark yellow with the red flags, these are all new physical therapy places. This one's not. This was reaction therapy, but has now become physical therapy. Therapy Center of El Paso, they are now doing outpatient PT. Before they were doing home health, and they also have aquatics. And this is the one on Joe Battle. That's right down the street from Reaction or Physical, and close to the hospital, if you all know who that is. UMC, they have 4 outpatient PT places. This one's on Burnham, which is south of the freeway. I think it's between, I want to say right around the Sumac area, south of the freeway, right around there. We have the other Physical, which is Health Masters, previously Health Masters. And then, where's the Rio Grande? Rio Grande Therapy, I put this one, this is light, but Rio Grande Therapy, they have, how many, Lydia, 3 or 4? 3, I think they have 3. They used to be just peds, but they do peds and adults. They used to only be OT and speech. They are now doing outpatient PT for both peds and adults. So you can see you all have more competition here. Spectrum Therapy is also down the street now. They've opened up on James Watt. There's a lot of doctors in that area, but also Dr. Tunde, thank you, Dr. Tunde's outpatient PT for peds and adults is also literally not even a block away. So that was an interesting place to put. And then west here, thank you. The west clinic here, we have, of course, physical, which used to be Health Masters with the, oh no, sorry, this was the one over by Northwestern. It was called, not spine and rehab, spine something, but anyway, they're now a physical as well. Not affiliated really with the other two, right? They're kind of like franchises.
Separate, huh?
Yeah, and then we have Border Therapy here. So Rio Grande Therapy is right here on Festival and North Mesa. If y'all have seen that one. Physical, this one is the physical that used to be Health Masters with the OSA group. And Optimum opened up, that is with Dr. Klein. I don't know what the name of the other one used to be. Pardon me? Patrick Brandon is a PT, yeah, and he's associated with Dr. Klein. And then that's Optimum. P3 is a man that on Schuster.
Who runs that P3?
That's the young lady. She's Indian. That's where somebody we know is coming over.
Sarah went.
Sarah.
Oh.
Sarah, yeah. Thank you. Yeah. Okay, so I think that's about it. So just wanted to give you all just kind of a real quick overview of what, that there's competitors opening up every day. I think Spectrum now has 5 open. Not too much here in the Horizon area. Of course, this is our new location. Dr. Norfor, formerly known as Dr. Nibby, pediatrician, and then Dr. Medin's down here. So just kind of wanted to give you guys a little overview. I think this kind of says the story in a nutshell with all the flags that we have for our competitors, the red flags. So just wanted to let everybody be aware of that. Our blitzes this year, we have the frutikis, the popcorn, and the donuts will start in the fall. Everybody loves those Dunkin' Donuts, so those will be good. Wanted to also update you on the 27th annual GPD physical, the walk and roll event. It's going to be Sunday, October 6th. We are silver sponsors this year, so we pledged $250 for this event. But we're also, I think the deadline for early registration is September 20th, right around there. So what I'm going to do is I'm going to go ahead and reserve 10 spots. And that's $20 per person, early registration. So the company will, again, pay for $10, and then the participants will pay $10. So we'd really like to see the PTs, PTAs out there, technicians also are welcome. So it'll be first come, first serve. So I'll be getting with the OCs, giving them a registration paperwork. So again, the first 10 names I get, we'll do that, and then it might increase to maybe about $25 or $30 a person after that deadline. So again, the company will pay for half, and then the participant will pay for the other half. But we'll have those at least 10 spots reserved for our company to participate in. So that's a good PR event for us to.
So we can roll.
You can
Those
walk.
of us that can't run
roll
or
or
walk,
wheelchair.
we
Yeah.
can roll.
Yeah, you can roll. And then just wanted to let you all know that I had a call from Kay Esquivel, and it was outpatient rehab, not inpatient. So they had closed down. They're closing down Las Palmas Life Care Center. What's today? The 13th. They're closing down on the 15th. The Las Palmas Life Care Center. So it is outpatient PT, and they are moving into the Oregon Medical Building, which is right next door to Las Palmas Medical Center. So I'm going to, after she moves and gets settled, I'll be meeting with her to see about reciprocating.
Margot, I thought it was the outpatient rehab on Wayborn, no?
No, I was wrong. It was outpatient. Outpatient that's inpatient.
Oh.
Yeah, sorry, my mistake. It was outpatient clinic, which is the Las Palmas Life Care Center. So they're moving into the Oregon Medical Building. So, so I'll be meeting with her to see what we can do about getting referrals. And we've also been getting referrals from a PTA that Rudy works with. Where is that from, Rudy? Which company?
Work at White Acres.
White Acres. So if you all know anybody that works in those places that want to refer, we have the refer a friend cards, because she got, I think, $75 for some of the referrals she's given us. So, it's easy, $25 per referral. So, y'all have any questions? No, I think I did. Yes.
So if we could follow back to the run, then the run, we have those 10 spots, and then companies just have it. After that, there's a couple
we'll do half and half, like you said, but I have to give you the information on how much it's gonna increase to, and we'll have that, posted up in the lunchroom, so you all can see that. But whatever it goes up to, after those 10 spots are taken, I think it's after the 20th. I mean, people can still register, and like I said, we'll pay for the half. Yes. And again, that can be also payroll deducted or cash or check for their portion. And your OCs will be collecting that information, the money. Okay. All right, I think that's it. I think we did good on time, so we can get everybody back to the clinic. Thank you all.
Really quick, Anna sent an email about t-shirts. So there's a special right now on no shipping, no logos. And we need $150 worth of orders, so if
And new colors.
you guys have, and there's new colors, so if you guys are interested, get with your OCs.
Thank you. Yeah, I forgot about that.